Why your back pain, herniated disc, bulging disc, degenerated disc are not going away. This is super important. There's 3 reasons your back pain is not going away. But first of all, what you need to know is there are things that you do that weaken the disc. Your posture, sitting too long, repeated bending, improper lifting habits, repetitive rotation, sleeping in certain positions, and weakened muscles ultimately all can cause a weakening of the disc. And it's the weakening of the disc and the activities that you do that continue to weaken the disc that prevent you from getting better. So what does that mean? When you sit for long periods of time, this is an example, you start to stretch out the fibers of the disc and the disc starts to get weaker. Now the disc is like a jelly donut. The top view of the disc looks like this. There's an outer portion that is thick and there's an inner portion that has jelly. So from the side view, it looks like this. Thick portion here, inside the disc is the jelly. Now, when these fibers start to get weaker, you'll develop little micro tears. So if you sit for long periods of time, or you repetitively bend for long periods of time, or you're lifting improperly over time, you start to get a weakening of these fibers. And this constant continued weakening of the fibers ultimately allows for the jelly to start to push out. That leads to the bulging disc and leads to the herniated disc. And constant breakdown of the disc over time eventually leads to the degenerated disc. So from the side view, the disc might look like this. There's fibers of the outer portion of the disc and you'll start to develop little tears, and that weakening results in the disc starting to push out, which is that bulge or that herniation. Now there's 3 things that prevent you from getting better, and if you fix these 3 things, your back pain can go away. And it doesn't matter what treatments you've had in the past and it didn't get better. If you fix these 3 things, the pain goes away every single time. And what is that? Well, number 1, it's moving in ways that overload the disc. We call it faulty movement patterns. So if you continue to move in ways that overload the disc, then the disc continues to get aggravated. And constant aggravation to the disc prevents it from getting better. That's number 1, constant motion, faulty movement patterns. Number 2 is an uneven load on the disc. Sometimes you'll develop certain muscles that get tight and certain muscles that get weak, and it changes the load on the disc. Discs need stresses distributed evenly in all directions, but an uneven load starts to put more pressure in one direction, which also continues to cause those micro tears and the weakening of the disc. So number 2 is you have to balance the load. Number 1 is you have to avoid or eliminate faulty motion by making muscles stronger. And then you have to balance the load by stretching certain muscles and again making other muscles stronger. So it's a combination of muscle stretching and muscle exercising. But the third thing is potentially the one that causes the most trouble or prevents you from getting better, is lack of blood flow. Discs are avascular. They don't have a lot of blood flow, and because they don't have a lot of blood flow, they don't heal. You need healing to this disc. You need healing to these tissues. They can heal if you increase blood flow. They can heal because there's certain exercises that promote the activation of very specific cells inside the disc called fibroblasts that then grow more collagen, which strengthens the disc. There is a way out of this. It's 3 things. Number 1, like I said, moving in ways that overload the disc. We call it faulty movement patterns. Number 2, imbalanced muscle load on the disc. Number 3, lack of blood flow. You fix those 3 things, pain goes away, doesn't come back, because the pain is from this constant aggravation to the weakened tissues. Every time you aggravate it, it gets more inflamed and the pain doesn't go away. Now we have a program specifically designed to address these 3 issues. You fix these 3 issues, pain goes away, it doesn't come back. And it's all done online. If you have back pain that's not getting better, you can click the link in the bio. We will help you get your life back.